Mabuhay! I'm Doc Pam, a pediatrician for almost 2 decades now. In recent decades, we have encountered several emerging pathogens such as the Ebola and more recently, the COVID-19 pandemic. Interestingly, even diseases once declared eradicated like polio have re-emerged in some countries. This raises an important question. Why do these events occur? As a healthcare educator, I am to share valuable insights from the World Health Organization, CDC, and other resources. Through this, I hope to empower you future medical doctors to be better equipped in understanding, preventing, and managing these pathogens. So come on, join me and let us explore the answer to these questions. At the end of this session, you as a student should be able to differentiate between emerging and re-emerging pathogens and advocate for evidence-based practices. Now let us set the stage by watching this short clip. It highlights how quickly infectious diseases can emerge, spread, and impact global health. Pay close attention to the challenges and solutions presented, as we'll discuss this in more detail right after.
Mpox has been declared a public health emergency of international concern by the World Health Organization. The disease, formerly known as monkeypox, has spread rapidly across Central and East Africa since the start of the year. The initial outbreak was in the Democratic Republic of Congo, which has now registered 15,600 cases since the start of the year and more than 500 deaths. Health officials say the new strain of Mpox may be the most deadly yet. Joe Inwood reports.
It starts with flu-like symptoms and ends with this. This is what Mpox, which used to be called monkeypox, can do. Here in the Democratic Republic of Congo, the virus is common, but it's spreading. It's transmitted by physical contact or through the air. 5-year-old Sandrine has now recovered, but it was a terrifying moment for her mum.
She had a high fever and then she started to get lesions on her body. She had rashes on her arms, on her abdomen and even on her tongue. I'd been told it was a serious illness that could kill her, so I took her to the hospital.
Although it can be sexually transmitted, in the crowded camps of the eastern DRC, most of the patients are children.
So far, we have 130 suspected cases, and half of them under 5. Just 5% are adults. The most common way to get infected is direct contact from a sick person, and in the camps, children, they play together.
The latest outbreak has killed 450 people in the DRC. It seems a new variant, called Clade 1b, is more virulent and more dangerous. And it's now been detected in neighbouring countries, including Burundi, Kenya, Rwanda, Uganda, and the Central African Republic. And so, the World Health Organization has declared a global health emergency.
It's clear that a coordinated international response is essential to stop these outbreaks and save lives. A public health emergency of international concern is the highest level of alarm under international health law.
It is possible to vaccinate against Mpox, as happened in previous outbreaks. But these vaccines are not widely available in the DRC, where these children had to rely on their immune systems. The WHO is warning if more is not done to stop the spread of this new variant, the consequences will spread far beyond these camps. Joe Inwood, BBC News.
Now that you have watched the clip, let us check what you have learned from the video. What is the old name for Mpox? If you have answered monkeypox, then you are correct. You can get Mpox through, is it A, air with the virus, B, close contact with the secretions, C, sexual contact, or letter D, A, B, and C? If you answered A, B, and C, then you are correct. Vaccine against Mpox is it A, widely available, B, low in availability, C, not available yet? If you answered B, low in availability, you are correct. According to WHO, Mpox is a global health emergency. Is it A, true, B, false? And if you answer true, then you are correct. Now, is Mpox an emergence or reemergence pathogen? Before we can answer that, let us define emerging pathogen and reemerging pathogen. Emerging pathogen is defined as new or previously unrecognized pathogens affecting humans. Often it is zoonotic, it is capable of rapid adaptation, and it is highly transmissible in a lot of cases. So, can you think of a pathogen with these characteristics? Examples would be the SARS-CoV-2, the Ebola, the MERS, H5N1, Nipah virus, and Zika virus. So among these diseases, do you recognize any of them? Now let us delve deeper. The disease caused by SARS-CoV-2 is COVID-19, and it was discovered first in Wuhan, China in 2019. I know that you are very familiar with this pathogen. Another is the Ebola virus, which is called the Ebola virus disease, which caused the Ebola virus disease, discovered in 1976. And if you are born in 2012, there's a pathogen called the MERS, which caused the disease MERS, and it was discovered in Saudi Arabia. That was discovered later after avian influenza, which is H5N1, discovered in Hong Kong in 1997, and the Nipah virus in 1999, which is a paramyxovirus, discovered in Malaysia. And then, one that is very popular nowadays was the chikungunya virus, causing the chikungunya fever, which was discovered way back in 1952. I remember I had my first out-of-the-country tour in Hong Kong. The fare at that time was very cheap. It was only 4,000 for two-way because that was just right after the H5N1 or the avian influenza. What could be the probable reasons for pathogen emergence? It has been observed that it could be due to a zoonotic transmission, and this can happen during interaction between humans and animals. Example in the wet markets and deforestations. For the Nipah virus, the pig farming near the bat habitat have been thought of as the cause of spread. Another is globalization. It is through increased travel and trade that has made the spread globally. For example, if you remember, SARS spread rapidly from China to 29 countries in 2003 via air travel. And it can also be due to environmental changes, wherein the urbanization and climate change created new habitats for vectors, like the Z virus, which has been expanded due to the spread of the Aedes mosquitoes, more increase in their habitats, which are the stagnant water, especially during rainy seasons. And another would be the human practices. Could be misuse of antibiotics, improper waste management, and industrial farming. Let's look on the characteristic of each pathogen. So here is a table. SARS-CoV-2 is an RNA virus that mutates rapidly. Zika virus is a flavivirus. H5N1 is also a virus. And here we can see the probable reason for its emergence. You can review this table on your own. Now let us define re-emerging pathogen. These are pre-existing pathogens with renewed prevalence. So it could be endemic in one country and then it has increased in cases, or it has a spread. And it is often associated with antibiotic resistance or vaccine hesitancy. And it may exploit weakened public health systems or climatic changes. So can you think of pathogens that are re-emerging? So if you have listed Mycobacterium tuberculosis, Yersinia pestis, Vibrio cholera, measles, dengue, polio, and Corynebacterium diphtheria. These are reemerging pathogens. Remember, polio has been eradicated for a long time in the Philippines, but due to the pandemic, wherein there are no vaccination available for everyone, polio, not just in the Philippines but worldwide, has re-emerged. As well as measles, because other parents doesn't want their children to be vaccinated too. Let us delve deeper to the probable reasons for the pathogen's re-emergence. So number 1 is the antimicrobial resistance. Overuse or misuse of antibiotics, which leads to drug-resistant strains. Remember, when some child has a fever, they would give amoxicillin or cotrimoxazole as their first aid without the proper medical consultation. And that has increased the antimicrobial resistance, hence the reemergence of the disease. Mycobacterium tuberculosis, because sometimes, since it's a long therapy, 6 months or 9 months, patients who have the MTB has poor compliance with their therapeutic regimen. And with that, it is harder to treat the disease because the pathogen has developed resistance to the drugs. So it would require more drugs and higher drugs. Next is the vaccine hesitancy or low coverage, which we were able to witness during the pandemic. Children are not allowed to go out. We need to stay at home, bawal lumabas. So there are reduced immunization rates. Hence, measles and pox has re-emerged. Social disruption due to war or displacement or poor healthcare access, which would increase the vulnerability of patients. And environmental changes as well, because there has been increased rodent populations, plague cases has risen in some regions. So here are the characteristics of the re-emerging pathogens in a table. So MTB is a bacteria, Yersinia pestis, a vector-borne bacteria, Vibrio cholera, waterborne bacteria, and here are the probable reasons. Poliovirus is an RNA virus. For the specific characteristics of each pathogen, I am leaving the individualized reading as you have already tackled this in other topics. So let us wrap up this section through a quiz again. So emerging pathogens are new or previously unrecognized pathogens affecting humans. An example is or are A. SARS-CoV-2, B. Ebola virus, C. M. tuberculosis, or D. A and B. And if you answer that's A and B, that should be A and B, then you are correct. It's SARS-CoV-2 and Ebola virus. Re-emerging pathogens are pathogens that existed but are now increasing in incidence or geographic spread. Probable causes are zoonotic transmission, environmental changes, human practices, and globalization. Globalization can be explained by A. Increased travel and trade, B. Urbanization and climate change, C. Misuse of antibiotics, and D. Interaction between humans and animals. And if you answer A, increased travel and trade, then you are correct. For that reason, chikungunya, which was first discovered in 1952, is now a re-emerging pathogen, and this is the worldwide distribution of chikungunya. What are the probable reasons for pathogen re-emergence? Is it A. Reduced immunization rates due to disease outbreaks, B. Overuse or misuse of antibiotics, C. War displacement, or D. A, B, and C? And if you answered D, A, B, and C, then you are correct. After being able to differentiate emerging and re-emerging pathogens and its characteristics and clinical characteristics and its history, let us look on the global and national health efforts done. Do you remember March 15, 2020? Where were you on this day? In the Philippines, in March 14, 2020, there are Filipinos hoping to get on flights out of Manila because it is placed on lockdown queue at Ninoy Aquino International Airport. They know that on March 15, 2020, there will be a lockdown, but it was the first time among a lot of us, and nobody knows what lockdown really means at that time. There had been quarantine protocols, bawal lumabas, even a song made, travel protocols, no one is allowed to fly, only returning residents to the US, but if for tourists, no tourists are allowed to travel, even seniors not allowed to go out, and other health protocols like social distancing, wearing of masks, the swabbing, the rapid antigen swabbing, and then the COVID-19 vaccination. You remember those who have comorbid first, or those who are working in the health care first, and then everyone is lining for the vaccination, and not everyone is given at once. And during the first variant, we know without the vaccination, we know that there are a lot of morbidity and mortality. So let us look on the WHO's role and DOH role. We can see that there are health emergency responses, health surveillance, there are health global programs, and there are pandemic preparedness and response, vaccination programs, health guidelines and standards, technical assistance, and partnerships and collaboration. For the vaccine before, there were a lot of donors to the Philippines, so we were able to increase the vaccination rates at that time. We also have surveillance and monitoring tools. We need to survey like the number of cases of tuberculosis, of measles, of polio, so that we know what's happening, and this could be managed as well. So one has to report the cases, disease reporting, global surveillance, health monitoring systems. Remember, after vaccination, the vaccination teams has an IT and would report those who have been vaccinated for the day, and then they will report it to DOH or the national, and then to the WHO. And UNICEF, CDC, these are partners who would also help not just in vaccination but in nutrition. For your information, that there has been this effort done. And number 4, let's look on how WHO and DOH responded during the COVID-19. So initial detection and reporting, guidelines and protocols, as has been said earlier, vaccine distribution and public health campaigns like Be the Solution, bida ka kapag nakapag-vaccine ka, and others. For vaccine hesitancy, they gave the vaccine free for dengue, vaxia. So these are the challenges because there has been a lot of reaction to the vaccine at that time. Because you have to have the vaccine if you have a first infection. It's not being given to those patients who did not have the dengue. So it should be laboratory-wise, there should be antibodies that can be seen in the blood. And yes, there are overstretched health facilities as a challenge for the health system. Now, remember before, no mask for everybody, and we have to make our own masks. So these are the shared efforts, and this will be for your own reading. To know more about the WHO efforts, surveillance, and others, you may visit the site. Now to go back to the question, is Mpox an emergent or re-emergent pathogen? I will provide a monkeypox handout and case study questions that will be given to your moderator.